once the diagnosis is made, or once it's clear this is a real problem, what is the impact on patients living with this disease? I mean, there's a lot going on.
Yeah, sure. I mean, the patients often feel like they're left out of the normal activities in childhood. You know, in the South, it's playing football with their friends and participating in aggressive contact sports. And those are things that we have to obviously have some restrictions on, because I saw a kid yesterday and he developed an intracranial hemorrhage from heading the soccer ball. And his mom won't let him go anywhere near a soccer ball these days, even though he's 19 years old now. And so obviously, you know, we just have to be protective, and we don't know when they're going to develop those bleeding events. There's nothing, and so groups like the National Hemophilia Foundation have listed what are considered safe activities. Obviously, not being able to participate and do some of the things can lead to anxiety issues, some depression, and we definitely see that in studies of children and adults with that. And you're living in constant fear of having a bleeding event that could affect your life, and so you can imagine how that would change. You know, you change your trajectory of their lives.
To that mom who said no heading soccer balls, no soccer balls, right on. Good idea.
It can be, sorry to interrupt, but it can be as simple as kind of adult patients wanting to mow the lawn, or or do some simple things with their kids.
Yeah.
Okay. You know,
driving the car. If you develop joint bleeds in your elbow, you're not able to drive the car, do a stick shift, and just activities of daily living. Yeah, you're right. That's a good point.
So what are the medications you need to avoid in hemophilia? Let's get back down to some basic pharmacology here. And what other kind of cautions do you give to folks? Who wants to start us off on that?
Well, often when we look at our medical record, we see an allergy to NSAIDs and to aspirin. It's not a true allergy. It's just something that hemophilia patients shouldn't
It's there for you guys to notice.
Exactly.
Yes.
So, you know, it can cause GI bleeding possibly, so we certainly wouldn't want that in a hemophilia patient.
I see allergies on the chart all the time. I'm allergic to morphine.
Yeah.
What happens?
Yeah.
My breathing slows down and I itch.
Yeah.
I gotcha.
Yeah, we put that as an alert, but it's a good way for people to notice it. You notice an allergy.
You put it in the allergy section, they get the wristband.
Exactly. Yes, exactly.
Don't go there.
Do not give Advil.
So, if you want patients to live as normal a life as possible, and you want to get to the goals of therapy, what do pharmacists contribute to this? How do you help?
Well, instead of NSAIDs, you could recommend Tylenol. Tylenol is fine in a hemophilia patient.
My liver transplant people would disagree.
In moderation, right?
Yeah, or just ice and rest for an injury, resting the joint. We have like ice packs that we give patients that aren't like super cold, the ones that you can put right on the joint. They might not need an NSAID. Wearing a medical bracelet for hemophilia might be a good idea, because then, you know, doctors will know not to give them aspirin and NSAIDs, or just in case they get in an emergency or an injury, that people know that they have hemophilia.
But it's important to know too that as our hemophilia population is aging, there's going to be patients who are going to be developing cardiac disease, and aspirin might be part of their treatment.
Yes. Yeah.
So it's something to, that's when you want to consult your hematologist.
But that's
your cardiologist.
But that's a real Hobson's choice,
yes.
Right? I like that Hobson's choice. I mean, here we have a life-saving medication. And I mean life-saving in terms of aspirin and heart disease. And yet, typically, possibly, life-threatening medication at the same time. How do you balance that out? What would you say?
Well, I don't have any patients that are on aspirin.
How old's your oldest patient?
We do have some patients in their 50s, but that brings up the HIV thing from the 80s, is that a lot of our older patients have HIV or hepatitis, so we don't really see any patients well into like their 70s or anything like that. Sure. We will in the future, hopefully.
You will now.
Right.
But I don't have any patients that are really in that old. I do have some people that are on Celebrex, some of the NSAIDs that are the newer ones that are less targeted towards clotting. Yeah,
we just recently had a patient who had 3-vessel stents placed, and so he is on antiplatelet therapy.
He needs antiplatelet drugs.
Exactly. So
this is a non-trivial issue.
So he was a challenging patient to kind of get stabilized. And
now, what about physical therapy here? I mean, my my view of physical therapy is that it may provoke joint use and may, in fact, provoke some bleeding, no?
So, it depends on how aggressive the physical therapy is, and they have some modifications in what they do, and thankfully we have most of them in our treatment centers, and so they could advise the outpatient physical therapist. But particularly the ones that are on prophylaxis, we sort of shift their prophylactic dose to those physical therapy sessions. But if more and more you go to these meetings, you see that it's important to increase the muscle mass and make sure that the joints are stable, because you're protecting those joints with good exercise. And we talked about they're already at risk for osteoporosis and decreased bone mineral density. And so it's important that they increase their physical activity, but they choose activities like swimming, and be a little bit careful about jogging and other exercises that are potentially harmful to the joints. And, but we know that there's that good balance there, and obviously trying to stay in shape and working out, because we have a lot of our young guys that want to bench press as much as they can, and we always say, well, if you can do it in 20 reps, that's an appropriate amount of weight to do. To stay healthy, you don't need to look like, Arnold Schwarzenegger.
If I'm a dentist and I hear somebody's coming to my practice with hemophilia, I might run for the hills, and yet they need dental care.
Some of them
course.
do run for the hills.
And they do, yes.
So how do you manage that? What do you do?
A lot of times the HTC, Hemophilia Treatment Center, will have a dentist associated with it that is familiar with hemophilia patients. But some hemophilia patients do struggle to find a dentist that will treat them, because they just, like you said, they don't want to deal with it. It's too complicated.
Yeah.
Yeah, I mean, we're fortunate to, work at the University of Minnesota, where there is a dental school, and a lot of our patients do go there, and so they are familiar with working with hemophilia patients. But, there can be some kind of proactive work done, such that, they may have Amicar available, which we'll talk about shortly, and so that can prevent some of the bleeding issues that
The
could
key
come.
thing is for us is the communication. We have our own dental hygienist, and we have one at our hospital that does hundreds of dental procedures a year. And we always feel like that person that may move on, and now they have that expertise to go out and teach their colleagues. But just like anything else, we come up with very strict bleeding plans of what to do and what not to do with those patients. And so they don't let the patient say, oh, don't worry about it, I'll probably be fine. They get a very direct plan of this is what has to happen before you want to do that procedure.
I have heard through the grapevine, medical grapevine, that people with hemophilia often have very poor dental situations, if you will. I don't know what else to say. Their teeth aren't great.
Yeah.
Is that part of the disease or part of the lack of treatment?
I think it's a part of the lack of access to care. And in the United States, dental access is a big problem, and then you take something potentially could lead to significant bleeding, and it gets worse. And we actually conducted a study at our center, and we looked at simple things. How often do you brush your teeth a day? And we were kind of alarmed at how often people brush their teeth. Actually, the majority of people brush their teeth once a day. And I kept thinking, do you brush it in the morning or the afternoon? And which one? I don't even know which one is better. But that was pretty alarming to us. And the only predictor of poor dental health was whether the parents had poor dental health as well. So there's probably some bacteria issue as well.
Okay.
But it comes down to simple things. We actually started handing toothbrushes out at our clinic and say, brush your teeth twice a day. Just simple message like that. Sometimes it's very simple.
But I'm afraid because I'm going to bleed from my gums.
Exactly.
Don't you get that?
Yeah, so, well, they say that, but then they don't bleed, don't do that good dental care. They get horrible gingivitis and they're oozing. And then they have to go and have 6 teeth removed at one time, which is a costly and potentially morbid procedure.
Sure.